अस्सलाम वालेकुम दोस्तों, उम्मीद रखता हूँ आप लोग खैरियत से होंगे। आज मैं आप लोगों के लिए कुछ गिने चुने एमसीक्यूज अपलोड करने जा रहा हूँ, जो कि 35 एमसीक्यूज है। एक सेट है 35 एमसीक्यूज का। इसको ज़रूर आप लोग रीड आउट करें, इसको इग्नोर बिल्कुल भी ना करें, क्योंकि 75% आपके एग्जाम में ये एमसीक्यूज इसी तरह के एमसीक्यूज आएंगे और मे बी सेम टू सेम एमसीक्यूज हो। तो आप लोग इसको बिल्कुल भी इग्नोर ना करें और इसको बार बार मेरी वीडियो को देख ले। एक दफ़ा समझ ना आए 2 दफ़ा देख ले, 2 दफ़ा ना आए 3 दफ़ा देख ले। वीडियो में जाने से पहले मैं आप लोगों को एक रिक्वेस्ट ज़रूर करूंगा कि जिन्होंने हमारा चैनल सब्सक्राइब नहीं किया वो हमारे चैनल को सब्सक्राइब करें।
1. The client with color blindness will most likely have problems distinguishing which of the following colors: A. Orange, B. White, C. Violet, D. Red. And the correct answer is C. Number 2. Side effects of Lasix furosemide drug is A. Hyponatremia, B. Hypokalemia, C. Hypoglycemia, D. None of these. And the correct answer is B. Number 3. 30 for weeks, gestational with irregular painless contraction. This sign's called A. Heger's sign, B. Braxton Hicks, C. True labor, D. None of these. And the correct answer is B. Number 4. Which of the following related to high-pitched breath sound? A. Wheezing, B. Bronchia, C. Crackles, D. Ronchi. And the correct answer is A. Number 5. A 32 years old man develops chronic productive cough. He has not been feeling hungry and has lost 3 kilograms of body weight in the past 3 weeks. On examination of his lung fields, there was diminished breath sound and widespread crackles. An early morning sputum culture was sent to the lab. A. Droplet, B. Contact, C. Airborne. And the correct answer is C. Number 6. A nurse working in medical unit is preparing to with droplet precaution measures in place. The following personal protective equipment: eyewear. What is the correct sequence for putting the equipment on? A. Face mask, gown, eyewear, and gloves. B. Gown, face mask, eyewear, and gloves. C. Eyewear, clothes, face mask, and gown. D. Gloves, gown, face mask, and eyewear. And the correct answer is B. Number 7. Mr. X attended an outpatient clinic with symptoms of shortness of breath, diarrhea, and severe respiratory distress. Which of the following is the best diagnosis of Mrs. A case? A. Coronavirus, B. Swine flu, C. Zika virus, D. Hepatitis. And the correct answer is A. Number 8. Year-old man is diagnosed with tuberculosis TB and negative pressure room. Which of the following should wear a face mask? A. Patient's healthcare providers, B. All people who enter the patient's room, C. Person has close contact with the patient, D. Family members who are at risk for infection. And the correct answer is B. Number 9. A toddler is seen in the emergency room with a history of high temperature for 5 days. He had watery eyes and a cough for the last 3 days, and then he developed a rash all over the body which started in his face and spread down to his body. The mother did not remember the vaccination schedule of her son. For how long the child should be isolated? A. 5 days, B. 10 days, C. 15 days, D. 20 days. And the correct answer is B. Number 10. Patient with measles rubella is on airborne precautions. Which of the following precaution techniques would be essential to implement for non-immune persons entering the room? A. Gloves. B. Gowns. C. Masks. D. Face shields. And the correct answer is C. Number 11. A 5-year-old child is seen in the primary care clinic with mild fever, headache, and malaise for about 2 days, and today he has a rash filled with fluids. Which of the following is the best suggested diagnosis? A. Chicken pox. B. German measles. C. Measles. D. Scarlet fever. And the correct answer is A. Number 12. You have just admitted a patient with bacterial meningitis to the medical surgical unit. The patient complains of a severe headache with photophobia and has a temperature of 102.6 F orally. Which type of isolation should be suitable for the patient? A. Airborne. B. Contact. C. Droplet. And the correct answer is C. Number 13. A nurse receives a telephone call from the admission office of the hospital and is told that a patient with streptococcal meningitis will be admitted to the medical unit. The nurse is planning to apply infection control measures for the patient. Which type of isolation precaution the nurse must observe? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. And the correct answer is A. Number 14. Soldier was brought to triage area after being exposed to chemical weapons. Signs and symptoms of nerve gas exposure were noticed. A nurse prepares for medical management. Which medication should the nurse prepare for the patient? A. Atropine. B. Adrenaline. C. Sodium nitrate. D. Sodium thiosulfate. And the correct answer is A. Number 15. Physician orders an intravenous fluid of DSNs at 100 cc per hour. This is an example of which of the solution? A. Hyperalimentation. B. Hypertonic. C. Hypotonic. D. Isotonic. And the correct answer is B. Number 16. A nurse is carrying a patient diagnosed with pulmonary tuberculosis and she has to wear a 95 mask when she enters to the parent room. Based on the cycle of infection, which of the following is the reason to use the mask? A. Break the transmission chain at the portal of entry. B. Break the transmission chain at the portal exit. C. Kill the agent exits in the patient's room. D. Eliminate the reservoir of the bacteria. And the correct answer is A. 17. A nurse is preparing scheduled medications due at p.m. If a doctor orders paracetamol tab 1 gram kid and it was supplied from the pharmacy in 250 milligrams tablets, which of the following is the most appropriate nursing actions? A. Ask the pharmacy to provide 1 gram tablets. B. Call the doctor to recheck the dosage. C. Give the patient 4 250 milligrams tablets. D. Hold the medication and document in nursing notes. And the correct answer is C. Number 18. Clomiphene citrate clomid is prescribed for a 32-year-old infertility treatment. The nurse should understand that this medication is used FO following actions: A. Induce ovulation. B. Decrease prolactin level. C. Reduce endometriosis. D. Stimulate the release of follicle stimulating hormone. And the correct answer is A. Number 19. Which of the following statement by the nurse about the Clomid as an ovulation-inducing drug? A. Given for the first 15 days in each cycle. B. Maximum dose is 50 milligrams daily for a month. C. It increases the risk of birth defects. D. It increased the risk of multiple pregnancies. And the correct answer is D. Number 20. A nurse is assigned to care for a patient with small that needs to be placed on airborne precaution. Which of the following items should be used before entering the patient room? A. Gloves and gown. B. Gloves and goggles. C. Gloves and mask. D. Gloves, gown and 95. And the correct answer is D. Number 21. The nurse administered a dose of morphine sulfate as prescribed to a patient who is in the post-anesthesia care unit, PACU. The patient appears to be resting comfortably. The respiratory rate is 8, and the O2 saturation is 21 oxygen. Via cannula is 86%. The nurse should immediately administer A. Flumazenil romazicon. B. Midazolam versed. C. Naloxone Narcan. D. Ondansetron Zofran. And the correct answer is C. Number 22. The nurse is assessing a 65-year-old patient who reports the fatigue, weight loss, night sweats, and a productive cough with thick sputum. The nurse should immediately initiate isolation precautions for which of the following? A. Influenza. B. Pertussis. C. Bacterial pneumonia. D. Pulmonary tuberculosis. And the correct answer is D. Number 23. A patient is admitted to the emergency room with an unknown infection disorder. Which of the following is the most important measure a nurse implement to reduce the risks of transmitting these microorganisms? Other? A. Hand hygiene. B. Wearing gloves. C. Wearing a mask. D. Wearing a gown. And the correct answer is A. Number 24. To reduce the risk of transmitting methicillin-resistant Staph aureus MRSA from an infectious wound, which of the following precautions should be implemented? A. Airborne. B. Contact. C. Droplet. D. Reverse isolation. And the correct answer is B. Number 25. A nurse receives a telephone call from the admission office of the hospital and is told that a patient with streptococcal meningitis will be admitted to the medical unit. The nurse is planning to apply infection control measures for the patient. Which type of isolation precaution the nurse must observe? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. And the correct answer is A. Number 26. Morphine side effect. A. Tachycardia. B. Hypertension. C. Tachypnea. D. Bradypnea. And the correct answer is D. Number 27. Patient with a colostomy complains of itching of the peries, tornal skin. On assessment, the skin is covered in a red, Rash with white patches visible. What is the most likely cause of this condition? A. Not changing the pouch regularly. B. Candidiasis. C. Consuming acid-producing foods. D. Dehydration. And the correct answer is B. Number 28. What precautions are necessary when caring for a patient with hepatitis A? A. Gowning before entering the room. B. Wearing gloves for direct care. C. Wearing a mask at all times. D. Placing the patient in a private room. And the correct answer is B. Number 29. A patient was on a regular dose of lithium carbonate. The nurse that he has hand tremor, polyuria, diarrhea, and vomiting. What immediate action should be taken by the nurse? A. Diuretics. B. Withholding lithium. C. Calling the psychiatrist. D. Monitoring serum lithium level. And the correct answer is B. Number 30. Digoxin not given to patient who has A. Tachycardia. B. Hypertension. C. Tachypnea. D. Bradycardia. And the correct answer is D. Number 31. Which of the following is an example of epidemic point? Source: A. Tuberculosis. B. Public health agency. C. Contaminated water source. D. Communicable disease pavilion. And the correct answer is C. Number 32. A patient is being admitted in medical unit and has orders for fluid restriction of 1,400 milliliters 24 hours. He is receiving 4 medications and 50 milliliters solutions kit. How much fluid should the caring nurse allocate for CRA intake in 24 hours? A. 400 milliliters. B. 800 milliliters. C. 1,000 milliliters. D. 1,200 ml. And the correct answer is D. Number 33. A patient was on a regular dose of lithium carbonate. The nurse that he has hand tremor, polyuria, diarrhea, and vomiting. What immediate action should be taken by the nurse? A. Diuretics. B. Withholding lithium. C. Calling the psychiatrist. D. Monitoring serum lithium level. And the correct answer is B. Number 34. Which of the following is an example of epidemic point source? A. Tuberculosis. B. Public health agency. C. Contaminated water source. D. Communicable disease pavilion. And the correct answer is C. Number 35. A nurse working in medical unit is going out removing with droplet precaution measures in place. The following: personal protective equipment, eyewear. What is the correct sequence for putting the equipment off? A. Face mask, gown, eyewear, and gloves. B. Gown, face mask, eyewear, and gloves. C. Eyewear, clothes, face mask, and gown. D. Gloves, eyewear, gown, and face mask. And the correct answer is D. I hope you guys enjoy the video. Don't forget to subscribe, like, and share.